Hey y'all, welcome back to Culturally Prescribed. I'm Nana.
I'm Ashley.
I'm Oye and I go by Honey.
And today we'll be talking about CoolSculpting. So all things CoolSculpting, we hope you guys enjoy. Okay, so CoolSculpting. I'm actually very new to this, so it's not something that I've really heard of or knew was even an option to get rid of fat.
Yeah.
So I'm kind of excited to talk about this today and hopefully learn too.
Definitely.
So
Me too. And I've been seeing it everywhere. Just drive, especially in Nashville. I don't know what it is about
on
just
the
this area.
Signs,
Yes,
everywhere.
billboards.
Yeah.
They have like facilities that you pass, and it literally says CoolSculpting, like Nashville Cool Springs. You're just like, what's that?
And literally everyone's doing it.
Yes.
You can have anyone doing CoolSculpting these days. So
Yeah.
It's actually a pretty interesting procedure. So what it does is it's like this machine that freezes your fat. So let's say you're trying to get rid of your lower stomach fat area. And it's this machine that actually freezes the fat. So it crystallizes it and then your body gets rid of the crystals.
And I guess it uses your body's natural response to cold. So if you think about people when they're in intense cold, your hands kind of go numb and you get the darkening of your hands. And a lot of people, you have limbs that fall off with intense cold.
Yeah.
So if you think of that effect, but they use it and they direct it towards the fat. And so the machine kind of grabs the directed area and intensifies with the cooling to the fat area. And then just like Nana was saying, it causes the fat to crystallize and eventually your body kind of absorbs it and you end up going through your lymphatics and pee or poop or however the body kind of gets rid of
however you release your excess.
Yes.
And I also heard the fat actually freezes at higher temperatures. So when it's freezing, right, you have it and it's freezing your skin or your fat, your skin isn't, like you said, turning numb and cold and disintegrating, it's just your fat because obviously it cools at higher temperatures. So
Right. And so I believe each session lasts about 35 minutes. And I think your average person needs about 1 to 2 sessions to reach the desired effect. So I thought that was cool.
And people do it in a number of various areas. So it could be their lower abdomen, their flanks. You could even do the double chin. You could do the arms, the thighs.
Yes.
Anywhere that there is extra fat that you're trying to...
under the bra, anywhere. Not anywhere.
And I think it's the machine has to grab it.
Yeah.
So it has to be enough fat and a stubborn area where it's exercise, diet, these normal means of getting rid of the excess weight that we don't want does not help. It's resistant to it. And that is the reason that makes a person a candidate for CoolSculpting.
Yeah, like we said in the other video, you have to be a good candidate to really see the effects that you want to see.
Right. So you can't be so it's not used for obese people. It's also not used for people who don't really follow a good exercise and diet regimen. So it's generally for people who, follow a pretty good diet, they exercise, but they just have areas that are just resistant to their efforts.
Right.
So it's just a good alternative to really just really nip and tuck without the knife.
Yes.
Exactly.
That is the most attractive aspect of it, I think, is that you go into a procedure. It's about 30 or 40 minutes long. It does take a few months to weeks to months for you to actually see the results, but then there is no you have to stay home afterwards. You can go right back to work the next week.
No downtime.
Go right back to exercising the next week. Go back home and take care of your kids. There is no downtime needed, and you're not going under the knife. So it is. That is what makes it really attractive.
It's non-invasive, non-surgical procedure, so it's actually really great.
I think it's a bit uncomfortable because I know the doctor has to come in after and actually massage the area. And that can be painful. But that's about it. It's not a long-lasting, lingering pain. So that's a great alternative as well.
Definitely.
Yeah.
Yeah.
So side effects. I mean, I think that's something that we need to talk about too.
Definitely. Definitely. So other than the generic ones, or like the ones that come with a lot of other procedures that are done to remove fat, not invasively, so there is something called paradoxical adipose hyperplasia. And just like the name kind of says, it's an unwanted side effect. It's rare. It's not very common. It doesn't happen all the time. But what happens is you get an increase of fat in the area. And what happens is the fat kind of hardens and takes the shape of the CoolSculpting machine. And so now you're going to have this lumpy, like, butter stick looking thing on the body, and it's not a pleasurable outcome. It's not what you intended.
It's like the exact opposite of what you wanted.
Right. So that is something that is important to know going in, that there are these side effects that are not what you want, what you intended. And the way that this is fixed is usually it takes about 6 to 9 months. The person kind of just has to live with it and allow the fat to kind of soften up a little bit, because at this point it is very hard. It's like a stick of butter.
Wow.
And you have to let it get soft, and then after it gets softer, then they undergo liposuction. So because the treatment is pleasure, it looks good, it's appetizing to people because of the fact that you don't have to go under the knife. But then this is a side effect that causes you to have to, go into surgery and get liposuction to remove that.
To actually go under the knife.
Yeah.
So just be wary of that aspect of CoolSculpting.
Yeah.
If you just have, that extra fat and you just feel like you really need to do it, definitely do CoolSculpting, but know that PAH is a very common side effect. I don't know if it's common.
No, it's rare.
It's not common.
It's not common.
Okay.
Yeah.
It's rare.
It's not
so
common.
some, I think, more common, but still probably not very common. What you're, explaining earlier. So like the numbness, the tingling.
Yeah.
Maybe some pain, tenderness.
Yeah. Or bruising sometimes too.
Bruising.
You can have different colorations going on.
But I think generally people walk out with it unscathed, and they're okay. So, but just know that it could happen.
Right. And then there are a few testimonials of people who will say that they started seeing results like 3 weeks afterwards. Yeah. Like not even months. Like way before their second treatment, they see the results and they're like very pleased with it.
Yeah.
So it is something that I think if you look at the before and after photos, I like to see it. I need to see it with my eyes.
Yeah,
Let me see that this is something that really is beneficial and has good results. And you'll be like, wow.
You're like, let me check it out.
Yes.
That looks like a real option about
I think the best thing about it is it's non-surgical, non-invasive. Like, especially if you're like scared of knives, you don't want to be cut up and all that. I would definitely get it if I needed it, but clearly I don't.
You look good, girl.
Yes.
I appreciate that.
So, just one last thing. If you have these like specific, diseases, you might want to stay away from CoolSculpting. Cryoglobulinemia is one. Cold agglutinin disease is another, and paroxysmal cold hemoglobinuria. If you have any of those, unfortunately, you do want to stay away from CoolSculpting. So cryoglobulinemia is actually a condition where abnormal proteins in your blood thicken under cold temperatures. So when you're getting the procedure done, you can just have the abnormal proteins starting to thicken. And it can cause that side effect. As well as cold urticaria, which is a skin condition that causes hives on your skin when you get cold, right? And then the paroxysmal cold hemoglobinuria is a mouthful.
It's a type of anemia that destroys your red blood cells and when you're in cold temperatures. So these are all things that are exacerbated when you're cold. So just be wary of that.
Right. And make sure, like I always preach, your provider is board certified. Please do your research. Make sure that, and again, make sure that this is the right procedure for you. Because there are other ways to get rid of fat. So make sure that this is the best option that you have for yourself. Always make sure that you're open, honest, and transparent with your provider, because that is the best way that they are able to help you and make sure that you're able to get the effects that you desire. So,
Also, don't get lost in the hype too, because it looks good doesn't mean it's for you. So just make sure that you're doing something that is actually going to be beneficial for you. Right. And if exercise and drinking your water is the way, then that is fine.
That is
okay. Yes.
Yeah. So. Okay, so thank you so much for watching. We hope that you learned a lot about CoolSculpting, because I know I did. This is definitely very informative.
Yeah, this was definitely.
Yeah, this was cool. We hope you guys enjoyed. So please follow, like, and subscribe.
Give it a thumbs up.
Yeah, and please share with your friends. Alrighty, see you soon. Bye.
Bye.